what we do with advocacy in medicine, and it always is about this, is we advocate for our patients. We advocate for the ability for our patients to have access to timely, quality musculoskeletal care without the interference, with the little interferences they possibly can, and try to maintain as much independence as they can. And advocacy in that way falls along the lines of trying to improve patients' access to care and quality of care, and trying to support our profession so that we can do the best job that we can for our patients.
So to me, advocacy means being a voice for our patients. And, that means at the level of, dealing with their insurance companies all the way up to, the level of the government, state, and federal. Advocacy is important to me because, I want to take the best care of my patients that I can. And there are a lot of things that are beyond my control when it comes to patient care, starting with just access to care. And so I think one of the most important advocacy issues right now is making sure there's equitable access to care for patients in this country.
You don't buy an end result with money, you buy access. And unless you have access in front of the face of the member to make your case on multiple ways, you never get anything done. So the money buys the access. Your preparation before you get there to have access to the member is what helps you build productive relationship with the member. And that's how you get things done.
I think that one of the things as you go through your career and further up the ladder is that you realize that the biggest decisions that are often made, it should come down to a tremendous amount of data and analysis. And yet frequently the final decision is based on a relationship.
To the Hill, I went to the Hill and I advocated for research in orthopedics. And something that you realize is when you're out in Washington, D.C., you realize every other profession, whether it's a medical subspecialty or an other profession, everybody is doing it.
And in the beginning, when you start with all this, you had the idea that if you just practice medicine as an orthopedic surgeon, that the people who are in politics are in a position to make policy. You'll just do the right thing because it's the right thing for patients. And that will never happen.
And so every time I've gone to a political event, whether it's advocacy on the Hill or locally, that's time away from my family. And for me as a working mom, that's a sacrifice.
I was a bit skeptical, having not been involved in it before, that a single individual could have a significant impact. So how can I have any type of influence on the people that are making decisions and making laws about the way we practice and our opportunities?
Turning away and being like, I don't like this, I don't want to be involved, I've realized that there are things about, politics that probably aren't the greatest, but if I want it to be, used in the best way possible and to help, our patients in the best way possible, then I need to be involved in that and let my voice be heard and, advocate for my patients.
A lot of it is being able to do what we think is best for our patients in a timely fashion, but also being able to get patients from all walks of life and all socioeconomic backgrounds in to see us, into our office, and to be able to get them access to good quality care in a timely fashion.
And that is some of the disparities we see in the provision of healthcare in this country. And so, making sure that we're able to provide the highest level of care to every patient is really important to me. And that means, working with the government to ensure that insurance companies aren't dictating who we can see and how we can care for them, to ensure that, reimbursement is fair, regardless of the type of insurance that a patient has.
With these cuts and changes, it can also alter patients' access to doctors and healthcare in general.
And we were fortunate to let that happen. And then we've been involved, and it's really has made a difference in a number of areas. And I realized it took a few more years to get shoulder arthroplasty off the hospital inpatient list, but realized that they moved over 260 cases out of that list. And now they moved almost all of them back, but one of the three they didn't is shoulder arthroplasty. And I really believe, in no small measure, that's because of the work that we did to educate CMS
I realized through advocacy that it's really a marathon. It's not a sprint. Advocacy takes time to develop relationships. It takes time to understand the issues and promote our profession, but it's really important and it's worthwhile. And if we want to compete with the best and the brightest of other subspecialties, we have to do it. It's required of us.
I would encourage those that are skeptical or want to think twice about advocacy and don't really believe that it makes a difference, that they take some time and either go to your state meeting or go actually to the Hill and meet with the Office of Government Relations, see how they work, see how things work from the inside and the impact that we can have.
And now, especially with our more senior level members, instead of saying, I've kind of done what I can do and I'm just, I want to have a comfortable life. I get that. But you are actually in a position where you can pay it forward. You can now be that coach, that mentor to our younger members, but also you can be involved in things like political advocacy and share your views and visions and be very respected for who you are.
We are living in extraordinary times as it relates to the impending changes in the delivery of healthcare in this country. Past presidents Buddy Savoy and Tony Romeo had the vision to implement and execute the establishment of the Political Advocacy Committee to address this challenge. Inaugural Chair Ted Schlegel and committee members have been assiduous in advancing our advocacy mission on behalf of our patients, members, and society. Each and every one of us must commit to this important work.